Welcome to another episode of the Bug Bite, hosted by yours truly, Tech Coach Ralph, where we're engineered to win. In today's episode, we are going to be talking about something that was just made aware to me. There is an attack on United Healthcare, a ransomware where they have been locked out of their systems or something to that extent. I'm not 100% familiar with it yet. We are going to find out. My good friend Don just made me aware of it just the other day, and I wanted to explore that with you. So let's just dive right into what's going on and find out about this ransomware attack. All right. All right. So the title of this article is United Healthcare confirms ransomware gang behind Change Healthcare hack amid ongoing pharmacy outages. And this article is brought to us by TechCrunch, right? And it says ransomware gang ALPHV slash Black Cat claim huge breach of US patient records. All right, so American health insurance giant UnitedHealth Group has confirmed a ransomware attack on its health tech subsidiary Change Healthcare, which continues to disrupt hospitals and pharmacies across the United States. Change Healthcare can confirm we are expecting a cybersecurity issue perpetrated by a cybercrime threat actor who has represented itself to us as ALPHV Black Cat, said Tyler Mason, Vice President of United Health, in a statement to TechCrunch on Thursday. Our experts are working to address the matter and are working closely with law enforcement and leading third-party consultants, Manident and Palo Alto Networks, on this attack against Change Healthcare systems. We're actively working to understand the impact to members, patients, and customers, the spokesperson said. What's going on right now is there's a cyber attack on a part or subsidiary of United Health, Change Healthcare, and this article was written. When was this article written? This was written February 29th, 2024. All right. There's an ongoing attack. They're trying to figure out how deep the system is, right? Because based on our ongoing investigations, there is no indication that except the Change Healthcare systems, Optum, United Healthcare, and United Health Group systems have been affected by this issue. In a post on its dark web leak site on Wednesday, ALPHV, was that ALPHV? Black Cat took credit for the cyber attack at Change Healthcare. The Russia-based ransomware and extortion gang claimed to have stolen millions of American sensitive health and patient information. Ransomware gangs typically publish the name of their victims on their dark web leak sites, often as a way to extort the victim into paying a ransom demand. So ALPHV, Black Cat's claim could not be immediately verified. ALPHV took down the post claiming responsibility, sometimes an indication that the victim is negotiating with the hackers. United Health Group spokesperson Mason did not respond to a comment asking if the company paid a ransom or is in negotiations with the hacker. All right, so now the hackers are trying to get some money up out of United Health Group, and we're going to find out if they paid, what's going on. All right. So TechCrunch confirmed Monday that the ongoing cyber attack was linked to ransomware. Reuters first reported the news. We continue. United Health Group owned subsidiary Change Healthcare is a health tech giant and one of the country's largest processors of prescription medications, handling billing for more than 67,000 pharmacies across the United States healthcare system. The healthcare tech giant's website says it handles 15 billion healthcare transactions annually, or about 1 in 3 U.S. patient records. So right now, it's like this attack is so important because people are going to be prevented from getting their prescriptions. Their information is going to be leaked all across the world, and into whose hands. So one thing that's interesting is to find out is how did this actually happen, which we'll probably find out later, if not in these articles, right? We'll probably find out later what caused the breach and how they got in. Was it social engineering? What was it? So that's what we're looking into. That's what we're trying to figure out. So let's keep reading. Change Healthcare merged with U.S. healthcare provider Optum in 2022 as a part of a $7.8 billion deal under United Health Group, the largest health insurance provider in the United States. The merger allowed Optum broad access to patient records handled by Change Healthcare. United Healthcare Group collectively provides over 53 million U.S. customers with benefits and another 5 million outside of the United States, according to its latest full-year earning report. Optum serves about 103 million U.S. customers. All right. So So this is the potential. This is the potential of whose data is in the hands of these hackers who are demanding a ransom from United Health Group, right? So pharmacy outages stall prescriptions. The cyber attack began on February 21st, early on the U.S. East Coast, causing widespread outages at pharmacies and healthcare facilities. Change Healthcare said it took much of its systems offline to expel hackers from its systems. Change Healthcare's incident tracker page shows most of the customer facing systems remain offline. Hospitals, healthcare providers, and pharmacies across the United States have reported that they are unable to fulfill or process prescriptions through patients' insurance. Right, so now people like if you really need it, you might have to come out of pocket and try to get reimbursed. But you know the price of prescription drugs. Nebraska television outlet KLKN-TV reports that the majority of Nebraska hospitals are unable to verify patients' insurance for inpatient stays, provide precise cost estimates, or process patients' billing as a result to their ongoing cyber attack at Change Healthcare. U.S. military health insurance provider TRICARE said in a statement this week that the cyber attack at Change Healthcare is impacting all military pharmacies worldwide and some retail pharmacies nationally. Right, so this is big. This is like impacting the whole entire world, caused by Alpha V Black Hat Group. All right, United Healthcare previously attributed the cyber attack to an unspecified nation-state actor. Researchers have yet to determine a link between Alpha V Black Cat Group and a government. The ransomware problem has been getting worse for years. If governments don't get it under control quickly, critical services will continue to be disrupted with potentially catastrophic consequences, said Brett Callow, a ransomware expert and a threat analyst at MCSoft, told TechCrunch. It's not yet clear how the hackers gained access to Change Healthcare system. In an interview with TechCrunch on Thursday, ConnectWise Chief Information Security Officer Patrick Beggs ruled out a recent vulnerability in his company's product as the cause of the cyber attack at Change Healthcare. With all the subsidiary, with all the subsidiaries, including United, all the way down to Change Healthcare, we have no record or no indication of any managed service provider supporting them or themselves having Screen Connect installed on their infrastructure, Beggs told TechCrunch. United Healthcare made $22 billion in profit during 2023, according to its full year earnings filed in January. According to the company's most recent report on executive pay, United Health chief executive Andrew Whitty received close to $21 million in total compensation during the previous fiscal year. I'm not sure how relevant this is to the cyber attack, but that's what they included in the article. So this is what we have going on right now, right? So this was written on February 29th. Yes, February 29th, 2024. And so this is an ongoing issue. Let's find out a little bit, like let's try to come closer to the current day and time and see what is going on now. So let's move on to an article in Routers written on March 8th, 2024. It says United Health to restore hacked medical claims and payment services mid-March, right? So it's not even yet, it's mid-March. So all right, so United Health expects to restore disrupted services for medical claims and payment platforms by mid-March, the company said late Thursday, as it grapples with the fallout of a hack that crippled its Change Healthcare tech unit late last month. United's Change Healthcare unit is a vital linchpin in the complex U.S. system for making and clearing insurance claims. The disruption also impacted electronic pharmacy refills. While its pharmacy operations returned online on Thursday, United Health said its payment platform will be operational on March 15th, and its medical claims network will be restored on March 18th. The cyber attack on February 24th at Change Healthcare was perpetrated by hackers who identified themselves as the Black Cat ransomware group, impacting doctors and medical practices across the United States healthcare system, like we just read, right? Many doctors depend on the system to verify insurance coverage, file claims, and get paid, sparking a campaign by hospitals and doctors for the U.S. government to provide financial relief as it did during the COVID-19 pandemic. The prospect of a month or more without restored Change Healthcare claims systems emphasizes the critical need for economic assistance to physicians, including advancing funds to financially stressed medical practices. U.S. Doctors Advocacy Group, the American Medical Association's AMA President Jesse Ehrenfeld, Jesse Ehrenfeld said in a statement. All right, so whenever there is a situation happen, everybody is looking to get paid, and that's when all of their troubles come out. So the doctors are now saying, "Hey, we need money. We won't be able to survive. We won't be able to survive." All right. On Tuesday, U.S. government said it would push its Medicare contractors to provide flexible payment terms. AMA and American Hospital Association, the AHA, said the government support did not go far enough. Of course, everybody wants a handout. All right, so that's where we're at right now. There is a hack. There's a ransomware. It looks like it's trying to get resolved. United might have paid, but we're not sure what the hackers did. They believe that their system is going to be back online on the 15th, so we shall find out. All right, let's go back to full screen. So that's tough, right? That is a tough thing that's happening right now because especially as secure as our medical records are supposed to be, that now they can be in the hands of these different cyber company, like these cyber attackers and ransomware people, and who knows what might end up happening to us, to our data. Like HIPAA is very, very serious. The government is serious about that. So it's interesting that what was happening to the biggest insurance provider. So we're gonna keep an eye on this, and I'm happy that Don brought this to my attention so that we could review it together. But that's where we're at right now. We need to be very, very careful with our data because apparently, the companies that we entrust our data to can't keep it that safe. So we have to be careful, give them the just amount of access needed, but not too much, and we can go from there. Okay. So if you enjoyed the show, thank you for tuning in. I really, really appreciate it. If you haven't done so yet, do me a big, big favor. Like the video, share the video, subscribe to the channel, and hit the notification bell so you can know every time that we go live. And if you are in need of one-on-one personal coaching, don't hesitate to go over to www.techcoachralph.dev and sign up for a one-on-one coaching plan, and we can get to the winning together. All right. Once again, thank you for tuning in. This is Tech Coach Ralph, and we are out.
If you enjoyed the fascinating information shared in this video and you want more, be sure to hit the subscribe button to Tech Coach Ralph to be notified for new videos.
Enigmatic Joker.